Hi, I'm Dr. Som, a board-certified plastic and reconstructive surgeon, and today we're going to talk about liposuction. So liposuction is a very commonly done procedure. It's actually in the top 3 most commonly done cosmetic procedures around the world as well as in the United States. What does liposuction entail? There are actually several forms of liposuction, and it's been around for over 20 years already. Actually, back to the late 70s, so now almost even 40 plus years. What does liposuction do? In the various techniques, it starts out with a simple incision, a small poke hole through which tumescent solution, usually a combination of saline mixed with some numbing agents, as well as an agent to help the blood vessels constrict, epinephrine. That gets injected into the area. That helps with the numbing of the area as well as breaking up the fat to allow for the actual liposuction to occur. That's followed up by an actual liposuction where, depending on the various devices that are available, whether it's standard liposuction, power-assisted liposuction, laser liposuction, or ultrasound liposuction, yes, there are very many forms. Then through liposuction, you come back in through the area and suck out that area, removing those fat cells permanently. Now, it is a permanent removal of those fat cells, but there's always some fat cells left behind. So if your patient does not continue with his diet and exercise, they will go back to where they were before. What's the difference between these various types of liposuction? There you get into a whole gambit of different things. There is standard liposuction, power-assisted liposuction, which actually most board-certified plastic surgeons will use. In particular, there's the most common device is called made by Micro-Air, which is actually the one we use in our office. What does power-assisted mean? Typically, when we do liposuction in a standard fashion, it requires multiple motions front and back to help, using a cannula, remove those fat cells. What the power-assisted does is eliminates all of that, and the handpiece itself does a vibrating motion to help absorb those fat particles. Now, the benefit of doing this versus the other various methods is it's better when we want to use that fat to re-inject in another area. So for fat grafting, for example, when we do Brazilian butt lifts, it becomes very nice. The quality of the fat is excellent. And actually, we can even use that same handpiece to reinstill the fat when we go to do a BBL, which is particularly nice in high volume areas like a Brazilian butt lift. In finer areas, we won't use the device itself, but we use fine little cannulas, for example, in the face, or we do a lot for breast reconstruction. In those cases, we'll use the different cannulas that we have that are a little bit finer and a little bit more delicate when we need something more sensitive areas. The various other types becomes kind of a different gambit of whether you want to call it a gimmick. Some are helpful for doing more work on tightening skin, such as the ones that heat the undersurface of the skin. But most of our patients, for our intents and purposes, we do a lot of fat grafting, so we have the power-assisted system in our office. So we're happy to answer any other questions. Feel free to contact us anytime. We're here for you.